Hey, people, good morning, good afternoon, good evening, depending on the time you're watching my video. Today, after having answered so many questions for patients, I just decided to bring in this beautiful information. They keep asking Nurse Aisha, what are my rights as a patient? Do I have any rights? Or better still, come on with mislead information. And when you want to tell them, they are right. It's my right. Okay, let me tell you your rights so that you know exactly where your limits are, the things you are supposed to do, the things you cannot do as a patient. Remember that as much as you have rights as a patient, the nurses and the healthcare personnel equally have rights. So we are going to be working in our own jurisdiction. We are going to be working in our own rights so that we do not step on the toes of each other. The nurse will work in his or her rights. The doctor will work in his or her rights, as well as you are going to be working in your rights. So since the doctor knows his rights, the nurse knows his rights, I want to tell you yours, because many patients do not know their rights as patients. Number one, you have the right for information. That simply means that when you go to the hospital, you have the right to be informed about your disease condition. You have the right to be informed about the procedures that are going to be conducted on you. You have the right to be told on what are your options so that you can choose. You can choose an informed option. They will tell you, Mama, as much as we have artificial family planning, we have natural family planning. They will equally inform you on the benefits and the effects of the artificial and the natural family planning and give you the go ahead to pick for yourself what suits you. Number two, you have the right to access of services. That simply means as a human being on earth, you have every right to at least have a health care, a health center, a hospital in your environment where you can go and have good health care, where you can go and have good health education, where you can go and ask for information pertaining to your health or the health of your loved ones. Number three, you have the right to choose. You have the right to choose whatever you want, whether or not it benefits you or it hurts you. Yes, you have the right. Just like euthanasia is not allowed in my country, as well as it is not allowed in many other African countries, euthanasia is allowed in the European countries as well as in America. Yes. So an individual can say, you know what, I have suffered enough. The family can decide to say, you know what, our loved one has suffered enough, and we think it is best for the individual to rest in peace. Just a reminder, death is not a failure. Sometimes in some people's life, death is another way of healing because it's going to take them off the pains. It's going to help them to rest in peace. Rather than living a vegetative or living as a vegetarian. Rather than allowing them to live a vegetative life on earth where they cannot do anything on their own. So yes, you have the right to choose. You can equally have the right to choose. You can go to the hospital where there are two doctors and you're like, you know what? I don't want to consult to doctor number one. I want to consult, or I want to be consulted by doctor number two. I do not want to see a general practitioner. I want to see a specialist, a gynecologist, a dentist, or an ophthalmologist. Yes, you have the right to choose as a patient. You have the right to say, you know what, I don't want hospitalization. I want to go home. But remember, when you are going home, the healthcare system, the healthcare policy says that what? We should make a note for you to sign. Just so something happens to you when you get home, they will not say that we allow you go home while you were sick. It will be noted that you went home against medical advice. If everything was told and you still decided to go home. Yes, a woman can decide to have CS and not go through labor pains. A woman can decide to refuse CS and wait for labor pain, even if she knew, even if she is informed that it is contraindicated to her health. You can choose, but when you choose, be ready to take full responsibilities of the action when the due time comes. Number 4, you have the right for security. That simply means that wherever you are taking healthcare, you have the right to be secured. You have the right to be safe. You do not have to be in the hospital and you are feeling like we are going to kill you. Neither do you be in the hospital and you're like, you know what? I feel like something is not going right here. You do not have to be in the hospital and you start seeing thieves coming in or things getting missing. You have the right to be secured. So if anything goes missing while you are in the hospital should answer for that. And if they can't give you vivid explanation to what is going on, and if everything has made mention indicates that they have no hand in whatever got missing, I think those that are environment are the best position to explain better. Because an issue with hospital and patient, believe you me, it might never be the same as it might be put out there. Number 5, you have the right to your dignity. That simply means that a nurse should not come into the ward where there are 15 patients admitted and they decide to give you a bed bath without screening your bed. You have the right for privacy and preservation of your dignity. Number 7, you have the right of comfort. Yeah, I know, right? Everybody likes to be comfortable. You have the right to be in the hospital and be comfortable. You have the right to sleep on a good bed, to take health care, to take treatment. You have the right to sit on a good chair that you are comfortable on. You have the right for comfort. There should be somewhere that you can eat that is close by. Number 8, you have the right for confidentiality. Confidentiality. This is one of the aspects in healthcare that many people contradict. Yes, it's contradictory because while you are talking about confidentiality to yourself, somebody else will not want us to keep that confidentiality. Now, I bring you a scenario. Just imagine that as a nurse, my sister comes to the hospital with her husband for biometrics in order to get married. And then upon doing them, we realize that the husband is HIV positive. And he says, you cannot tell my wife or my fiancé, my wife to be. You cannot tell my wife to be. And that wife is my sister or your sister as a healthcare person. Remember, I have the obligation and the oath to keep confidentiality to my patient. I am not in any way supposed to tell my sister what I have seen or the result of her husband who wants it to be confidential. And equally remember, I have every right. Because she is my sister, she will want me to tell her something as important as that. So why one person is feeling like confidentiality is the utmost, is something I'm supposed to keep short. Another person believes that as a sister, as a relative, I am supposed to tell them that they are walking themselves into their own graves. Yes, because if they are not told, how do you think that health education will effectively be given to the couples if one person is hiding the issue of the fact that he is HIV positive? Yes, I am not just going to give that only as an example because many people have found themselves into this situation and the nurse goes home depressed because now you are on a cross bridge in keeping confidentiality of one person and having your sister walk into the situation whereby you will not want any other person to walk in. Because it is in their right to go into that marriage knowing fully well that their husband is HIV positive and keeping to their own part of the bargain and taking medications as prophylactics while accompanying their husband to live a healthy and a good life. But if they have to keep this secret, then one person is bound to be infected because you are not going to have a good understanding or the health talk to be able to keep themselves or keep the one person who is not infected free from contamination. We are going to be talking about intimacy. Every patient has the right to intimacy. Now, in the medical field, intimacy is the situation whereby a patient, I will still take the information or I'll still take the example of somebody that is suffering from HIV. They have the right to have one particular doctor who understands their disease condition and who is ready to help them walk through that process without being stigmatized. They have the right to come back to that hospital and meet their doctor over and over and over and over again without having to go to explain to the next doctor, to the next doctor, to the next doctor about their disease condition. Yes, women will always have to testify to this because if you already have a gynecologist that follows you up, except otherwise, you will not want to have another gynecologist. You want to keep going to the same gynecologist. You want to keep having a continuous health check by the same gynecologist instead of moving from one gynecologist to the next because it's exhausting. It simply means you have to start from zero at every moment. And who wants to be given that history every day? So here and many others are the rights you have as a patient. You have the right for informed choices. You have the right for health education, just as I'm giving you. I am trying to exercise some of the rights that you have as an individual, as a good citizen. Now, the rights of a nurse will be on another day. So while we live healthy and happy, let's go ahead and enjoy the time that we have. Here is Nurse Aisha. I'm very, very pleased to be before you today because it gives me great joy to see that we all live in harmony in changing the healthcare system, in making sure that everyone is informed. Because as I say, health is not for a particular individual. Health is for you and for me so that we can live a healthy and a happy life. Thank you so very much. If you are my returning subscriber, I want to say thank you. I hope that today you get to learn something new. I hope that when you go to the hospital, you understand where your limits are. I hope that when you get to the hospital now, you know your rights, so that a nurse should not get angry when you ask them, what is the function of that treatment you're about to administer? With joy and with happiness, we have every right to explain to you what we are giving you, the function for which we are giving you, and the importance for which you need that into your system. Thank you so very much. It's your girl, Ness Aisha, your very favorite nurse. I'm happy to be with you today. Have a wonderful, wonderful day. Again, live healthy and happy. Ciao.